names are Monica Wanga Bloom, 25 years old. Was diagnosed with cancer of the esophagus in January 2012. After the diagnosis, we couldn't find a slot at the National Hospital because of the backlog, and because cancer of the esophagus affects the esophagus, the tumor couldn't allow me to feed. My weight had really gone down. By then I had reduced 20 kgs within a month because I wasn't feeding. My blood count was too low, my weight was really wanting. But funds became a problem, so we had like 3 major Harambes. So by May, that is when we could raise the needed funds. It was a big surgery which took 8 hours. And then after that, I was taken to high dependency unit where I developed pneumonia infection because of the cold there. But I've had challenges with feeding because now I don't have an esophagus. The stomach is small, so I can't feed on hard solids. I don't have the normal digestive system, so I have to be careful with what I feed on. So Faraja has really helped me in terms of the mental, the psychological part. That has really helped me a lot. So we were told it's good to do radio and chemo to just be sure that everything is okay. And the fact that my case has got some hope, the doctors are saying chances of survival after radio and chemo is 92% and above. Cancer is treatable. Cancer is not a death sentence like people think. And my request is that if we can have cancer center facilities open.
How are we going to raise the funds to do the chemo and the radio? And you see here the case by if we do the chemo and the radio, the chances of survival increases. So we just going around running here and there, and then at the last time when we are almost giving up, something comes up from Faraja. And Faraja, they have a big heart because essentially even when we started the radiotherapy, we were able to meet the board, talk of Shaira, talk of Philip, and then they were like, now you're already doing the radiotherapy, what about the chemo they have? According to Dr. Vijay, it's supposed to be concurrent to what we do. And they are like, they still have a big heart. They tell us, well, just to start with, let us again come in and do some bit of pay for your chemo again, the first session, as you organize yourself. And they're like, try to see what you can do and then let us know. It is so encouraging because we've been to so many places, we've been to so many people, we talked to so many people. Let us go to Faraja because God had directed us there. And it's good, it's good. We don't know if we can have something of that kind, if not for Faraja. They have a big heart, and that's what we need in Kenya. And so more so in Africa, where it's not only in Kenya, cancer to Africans is a death sentence. It is more than HIV. They say you are a gone case, doing all this effort for no reason. We've heard of it. People try to treat it after 3 months, they are gone, and they have wasted millions, they have wasted thousands of shillings. But we say it is better we waste that, but we try our level best, because at the end of the day, God asks you, I gave you this, what did you do? But we tried to, because God said we should take care of His creature on this earth. And I believe that is what Faraja is doing. Basically, everything came to a standstill. She was supposed to join college in January. We've gone to college, deferred like the second time, and you know that's the only opportunity. If comes January next year, she can't make it. As for me, it took another turn, because in Kenya, in Kiswahili, we have a saying that says, when you have a big problem, there's another one that accompanies it. So with her case, you see, I had like to be dismissed from my workplace. I looked at it and said, I either decide to continue the job and I neglect her, or I neglect the job and I look at her. And of course, again, at the end of the day, we still have a young boy, almost 2 years. And you see, it's a challenge. Everything changed. But totally, our lives have changed. We can't think of anything. First, you have to say, she has to have good health, then the others will come later.
Okay, I just started my radio last week and I had my first chemo session yesterday. So the only therapies I've done are movement and body talk. I've not been into so much because I just started last week. But as I progress, I think I'll learn more. And I'll just love to tell people that there are some lifestyle things we do that contribute a lot to cancer. So what I've learned, especially with cancer of the esophagus, is basically lifestyle. Excessive alcohol intake, excessive cigarette smoking, a lot of acidic foods. So if people could try and avoid such things, then they could reduce the risk factors that contribute to the growing of the cancer cells. There are some things we can do that can reduce chances of getting cancer. Although sometimes when cancer comes, you can't say this and this caused it. So if people could just try and look at their lifestyle, what they take into the body, what they expose themselves to, that one can really help reduce chances of getting cancer. And most especially a sore throat that does not heal faster. Because for my case, we treated a sore throat for 6 months, always buying antibiotics, doing this. Every time we go to the chemist, the pharmacist, they're like, this is a sore throat. But when I couldn't swallow, that's when I realized this is not just a normal sore throat. So I came to learn from my surgeon that a sore throat should be treated faster. A sore throat that does not heal after 3 months should really be a cause for worry. If you treat a sore throat for 3 months and you're not getting better, you should seek now further medical treatment, because a sore throat treated late could cause cancer of the esophagus, cancer of the throat, and heart disease. I would just like to urge people to be always keen on changes in their bodies, weight loss. If you just find that something is persistent, you should try and seek medical attention first. Don't wait for things to get to worse. That's when you run to the hospital.
And just talking about the therapies at Faraja, actually with me, I've been like a regular visitor to Faraja. Even when you're not having the sessions, I'll come maybe read a book. Like for her case, I'll come get a book. I remember the other day I was asking Philip if they have any literature on cancer of the gullet, and he told me there are few. And I think with time she'll also come to really get the therapies. Even yesterday when she was having the chemo, there was this lady who came for the body talk, and I think the therapies are a good thing. Not only the therapies, Faraja makes it like you converge as one big family with same condition, one mission, and you are like you can share and pleasantly exchanges like hi, how are you, and you know this also helps the body and the mind. You feel like there are people who can say hello, and sometimes when you go to like our national facilities here in the country, it is lacking. It's lacking. You can't find it so fast. It's a bit rare. You might get it once in a while, but we need to have more Farajas in this one.